Good morning once again. I would be briefly introducing the latest funding trends. I think they'll be discussed more in detail by the other speakers, but I would try to give you a general overview of what the funding trends are. This is the big picture that we have today, that AIDS has taken a heavy toll so far. 75 million people infected, half of them are no more with us, and another half living with AIDS. And the global progress in AIDS response, you have a positive, side of the entire issue. The new infections are reduced by about 33% in the last 11 years, and the AIDS-related deaths, there is a decline of about 29%. So this is a good news there. And this is something which is a very interesting information I think we need to have. By the antiretroviral medicines, we have been able to avert 53 million deaths all over the world. People from getting infected and from dying of AIDS. So this itself, I think, shows how important it is. It is no ordinary virus and no ordinary solutions will be okay with us. So I think this figure is something which we have to keep at the back of our mind. So it is worth every dollar we spend on AIDS, I think, for doing this work. Coming to investments, the investments on AIDS, it expanded globally very fast until 2012, and then it got flatlined. You see that from 2012 to 2013, there is just a 1% increase in AIDS investment, the global resources. It increased more than doubled in between 2002 and 2007, and then after that, you find this flatlining occurring. But the domestic investments, if you look at that, if you look at the left side of the graph, you will see the fund flow from 2002 to 2013 by funding source, domestic and external. The domestic resources accounted for more than half of HIV funding in 2013. That's a really good sign. But there is still a persistent dependency on international funding here. For example, low-income countries, still I think the domestic resources just make up 15% of the HIV funding. And even in low and middle-income countries, in about 50 countries, 75% of the assistance comes from external sources. So we still have a big problem there. But if you look at the second part of the graph, there is a huge increase in the domestic investment. And the most interesting thing is in sub-Saharan Africa, where you have the biggest epidemic, you find a 264% increase in domestic investment. So we can't say that countries are not putting their money into AIDS programs. Coming to the BRICS countries, the newly emerging economies, they have increased their domestic spending by 102% between 2006 and 2011. Today they contribute almost more than half of all domestic spending on AIDS in low and middle income countries, which is I think that's why the resources are getting released for the other countries which are in need of finances. And the latest information is the new development bank, which they have announced recently, which will be set up in Shanghai. And we hope that this bank will also add something to the AIDS financing worldwide. Coming to the external sources, the Global Fund, it shows the investment trends, and being the largest external donor, this is very important for us. The top of the graph gives the funding for HIV, TB, and malaria. But if you look at the bottom one, this is the total committed amount of HIV projects between 2008 and 2010, which is about 2.4 billion. And active HIV projects between 11 and 13 is 2.04, slightly less than that. But the new funding model of Global Fund says that they are going to commit a figure of something like $7.7 billion for the next 4 years. That's the cycle of 2014 to 2016. But out of that, about $4.9 billion is existing HIV funding, and the new funding is about $2.8 billion. I think Christoph probably will be able to explain it much more elaborately when he speaks. But one point I would like to make here, there is an overall concern, especially among communities, that the new funding model under which Global Fund will be probably limiting their funding in the middle income countries, especially the low middle income countries, it may hurt and it may impact upon prevention programs for most at-risk populations. So that is one point I would like to mention here. I hope Christoph will definitely talk about it in his presentation. The domestic funding increase, as I spoke, it really increased, and then this shows region-wise how the funding has increased in the last so many years, and definitely Sub-Saharan Africa, I think, has definitely increased the domestic funding. Now, this is a financing scenario which UNAIDS has projected, domestic and external resources. This is a very revealing slide. It shows two things. One is the financing gap which exists in the programs will get magnified until 2005. It will increase to as much as $5.1 billion if the existing external funding continues, but it can get narrowed down considerably if the low middle income countries, the one you find the light green part of it, that if it increases significantly in the last few years, by 2020, we can see that the financing gap can get reduced significantly. So it depends upon basically two things. One is the international financing has to hold at that level of 8.2, and then the low middle income countries have to increase their financing, domestic financing. So if that happens, then probably the funding gap by 2020 should be covered almost, except for a small gap of about 1.6 billion. Now, where the money is going? For sustainable financing, UNAIDS says that the optimal funding is needed for these three things: saving lives, averting new infections and AIDS-related deaths, and improve the quality of life with lifelong HIV treatment. If this need to happen, then you have to prevent an additional 4.2 million HIV infections among adults, about 1.9 million AIDS-related deaths, and improve the quality of life and life years gained for about 15 million people who will be accessing HIV treatment, and also virtually eliminate new infections among children. That means no MTCT. Now, where the money is going? The care and support services, they consume more than 55% of the total aid spending today, whereas only 19% is spent on prevention. And it remained relatively static over the last so many years. And the prevention programs, you find from the right side of the picture there, that prevention programs depend largely on external funding. And if you look at the prevention spending, again, this is a very revealing information here. Less than 10% of total HIV expenditure on prevention is spent on key populations. In all regions, you will find. And most importantly, the areas where you have the largest epidemics, like Sub-Saharan Africa and Caribbean, you find less than 2% of the funding is going to prevention programs among most at-risk populations. And also, if you look at the amount spent on MSM, that's the lowest. It is less than 2% across all regions. Less than 2% of the prevention money is going there. This is again very interesting slide. You find on treatment, there's a lot of focus. The money is going into antiretroviral drugs, it's going into opportunistic infection, going into home-based care. But when you look at prevention, very little money is going into focused programs for key populations, for PMTCT, and a huge amount of 63% is spent on others, which is just soft spending, low impact spending. So for investing resources strategically, what we need is, we need to refocus investments on populations with greatest need, both for prevention and treatment, and these programs should not be dried of funding until the new infections among these groups are reduced to a minimum of like 10% of what they are today. And also take into consideration the strong geographical skewedness of the epidemic and maximize investments in high prevalence zones like cities, urban areas, and semi-urban pockets. And we also need efficiency to be promoted through community-based delivery of services and integration of medical interventions like PMTCT and ART treatment into general healthcare systems. South Africa is a great example of efficiency gains. In 2011-12, South Africa revised its tender, introduced a list of reference pricing, awarded preference points for local manufacturers, encourage competitiveness, and they have been able to bring down the cost for antiretroviral medicine by 53%. Same thing, if you look at geographical approach, you find in Nigeria, 70% of new infections occur in just about 12 states and the federal capital. And in Thailand, 70% of new infections occur in 33 out of the 63 and odd provinces they have. So if there is a good geographical approach, definitely efficiency can be gained in investments. Now the challenges for smart investments, there are. One is the political. The political considerations for prioritization are the most important, and we are still not seeing it happen. It's still not a smart investment for political leaders. So sometimes we see the reverse, investments getting reduced for prevention among key populations. The second obstacle is the legal environment, which is a big challenge, which brands and punishes the key populations as criminals. So we have a big problem there. And most importantly, in some countries, we still don't have adequate data to show the cost effectiveness of programs. This is very, very important. Coming to the post-2015 development agenda, we find, again, we are talking about ambitious and aspirational goals like ending AIDS as a public health threat, because initially ending AIDS was mentioned, and later on I think it has been unpacked to show that we are not saying that AIDS will completely go away, but it will go away as a public health threat. And spending on AIDS is an investment and not an expenditure, and bridging the resource gap and continuing development assistance programs, especially targeting vulnerable communities, is very important. These are the messages which are going into the post-2015 development agenda, but we have to see how far people will take them on board. Now, ending the AIDS epidemic, as I said, as a public health threat, what it means, the definition of UNAIDS is that there should be a reduction of by 90% of the new infections, 90% reduction in stigma and discrimination, and also 90% reduction in AIDS-related deaths. So this is the latest from UNAIDS. 000 is becoming 90% now. No longer AIDS will be a major public health threat to any population or country. So what we need basically is a strong outcome-oriented goal for removal of AIDS as a public health threat, and continuation of external funding for focused prevention programs for key affected populations, and domestic resources should be committed for HIV-related services which can be integrated into healthcare delivery systems, and enactment and implementation of legal reforms for decriminalizing behaviors. But I would like to just go back to one slide. I'm not getting it here. Sorry, but I will just mention it here. There is some of you must have heard that there is a Copenhagen Consensus Center, which recently came out with a report where they have tried to assess the cost effectiveness of various development goals, the SDGs, which are being thought of by the Open Working Group. And as you know, the SDG 3.3, it talks about ending AIDS, tuberculosis, and malaria, and neglected tropical diseases by 2030. And the rating given to that is poor. So that means the economists of this world still think that investment in AIDS is not a great investment. So these are some of the threats I think we should be alive to. And when the new agenda, the 2030 agenda, is being discussed in the General Assembly of the United Nations, we need to be very alert to see that AIDS is not dropped off the agenda and it gets adequate priority. So with that hope, I wish you all, thank you very much.